Cox's Bazar is one of the most disaster-prone areas of Bangladesh, where women, adolescent girls, children, and the elderly are the most vulnerable during floods, landslides, and other emergencies. In the Cheinda Switch area, life is a daily struggle, not only against natural disasters, but also against challenges like lack of safe water, limited healthcare, early marriage, and even wildlife attacks. Vision Bangladesh Health and Education Society has stepped forward with awareness sessions on menstrual hygiene management, sexual and reproductive health rights, and child safeguarding, helping adolescent girls, women, and the wider community build knowledge, resilience, and hope. Vision Bangladesh conducted a session at the School for Adolescent Girls on Menstrual Hygiene Management, MHM. The session covered how to manage MHM during disasters, and taught girls what to do when menstruation starts. Several adolescents expressed that MHM education is essential. They now feel it is a life-saving need.
আসসালামু আলাইকুম আমার নাম জান্নাতুল ফেরদৌস আমি চেন্দা সরকারি প্রাথমিক বিদ্যালয়ের অষ্টম শ্রেণীর একজন শিক্ষার্থী
I am proud to be an adolescent girl and I live near Cheinda Primary School. Cox's Bazar. Before Vision Bangladesh came to our school, I wasn't aware of MHM. Now I know how to manage my period. At our school, there are no proper MHM facilities. We don't have girl-friendly toilets. When menstruation starts unexpectedly, we have to leave school and go home. So we miss important classes like math and science. I think it is our right to have these facilities and to know about MHM. In our community, early marriage is common because this area is disaster-prone. We need more support. I want more schools and more adolescent girls to learn about MHM and child safeguarding.
হ্যালো আমার নাম সামিয়া তাহসিন হক আমি চিন্তা সরকারি প্রাথমিক বিদ্যালয়ের একজন টিচার হিসেবে কর্মরত আছি মেনস্ট্রুয়াল হাইজিন ম্যানেজমেন্টটা আমাদের স্টুডেন্টদের জন্য খুবই ইম্পর্টেন্ট
I really appreciate Vision Bangladesh's initiative. Our adolescent girls were not aware of MHM or child safeguarding. I think we need more facilities. The school needs an MHM corner our adolescent girls.
Awareness sessions in the Cheinda Switch. Area for women and adolescent girls on SRHR, sexual and reproductive health and rights, especially NC antenatal care, PNC postnatal care, safe delivery, and MHM. The community where the sessions were held is mostly disaster-prone. During natural disasters, the most vulnerable are women, adolescent girls, children, and the elderly. During heavy rain, landslides, and when the switch gate opens causing flash floods, their lives become very difficult. They need more facilities for women and girls, including disaster-friendly toilets. They also need a local clinic for maternal services because the hospital is far. Sometimes they cannot bring their children for vaccinations. And in delivery emergencies, they cannot reach the hospital on time.
আসসালামু আলাইকুম আমি চেন্দাগুনাপাড়া সুইচ গেটের একজন কিশোরী আমি অত্র এলাকার সমস্যা নিয়ে কিছুটা বলতে চাই
She is happy that Vision Bangladesh is raising awareness, but the support is insufficient. Vision Bangladesh is supporting a little, but it cannot cover the whole community. Due to religious and social stigma and norms, many girls cannot go out. Also, because the school is far from the community, some girls cannot continue their education. They need pad supplies for MHM and school for children in the community. They lack access to safe drinking water and must struggle to get clean water. Life in this community is very challenging. They want to live with dignity and need increased support.
আসসালামু আলাইকুম আমি রেসপন্স ম্যানেজার হিসেবে ভিশন বাংলাদেশে কাজ করছি
We are trying to support this vulnerable community. We are providing awareness sessions to bring about social behavior change. This area is extremely disaster-prone and also experiences wildlife attacks, which make daily life very difficult. We cannot meet all the community's needs alone. We all together can expand more activities for supporting this extremely vulnerable community.
Assalamu alaikum warahmatullah. Wa arar elakan maze এখন ফাদ দসি যাগুয়া ওই যখন এরকম তখন দিয়া এখন ফাদ দসি যাগুই তোরে জ্বর বৃষ্টি হইলে ফাদ দসি যাগুই তা বাদে এখন আর কি বলি এই সুইচ গেট হইলে পানির বন্ধ হয়ে যাগুই
A community elder said their area is affected by landslides and flash floods, and that every night they cannot sleep because of wildlife attacks, especially elephants. Elephants come into localities at night, destroy houses and crops, and injure people. An elder woman said an elephant destroyed her betel leaf garden, her only source of livelihood. Now she does not know how she will survive.
Assalamu alaikum warahmatullah. আমার নাম আন্না রাশিদুল করিম, সিন্দাগুনারপাড়া 8 নম্বর ওয়ার্ড.
From evening until early morning, people work in shifts as guards to protect the community from wildlife, especially elephants. Elephants have destroyed his paddy, field and betel nut, garden, his sources of livelihood. The whole community is suffering. He said they need large torches and watchtowers so they can live safely. He also said that training on how to stay safe from wildlife would be very effective.
Asterisk, a woman said that an elephant killed her husband while he was working in the field. She is now living in very difficult circumstances. She cannot ensure daily food or adequate nutrition for her children and herself. Her husband was the only income earner in the family. Now, when people give her food, she can eat, but it is not enough to ensure nutrition for her children. Sometimes she becomes mentally distressed because she cannot properly feed her children. She does not know how she will live and sometimes feels hopeless. But for her children, she continues to live.
Assalamu alaikum. Dhonnabad, Vision Bangladesh.
One community member said, Vision Bangladesh provided trees to help the community cope with natural disasters. The community faces daily challenges from landslides. During heavy rain and flash floods, when the switch gate opens, women and adolescent girls suffer a lot. They need more support to improve and maintain their livelihoods and daily life. He urged, please increase your aid and services in our Cheinda Switch area.
The people of the Cheinda Switch area live every day with the harsh realities of disasters, lack of services, and even threats from wildlife. Yet, their voices carry strength, resilience, and hope for a better future. Vision Bangladesh Health and Education Society has taken important steps to raise awareness on menstrual hygiene management, sexual and reproductive health rights, maternal care, and child safeguarding. But the needs here are far greater than what one organization alone can provide. This community is asking for basic human rights, safe water, girl-friendly toilets, maternal health facilities, protection from wildlife, and opportunities for education. With greater support, together we can help build a safer, healthier, and more resilient future for the people of Cheinda Switch area. But this is not enough for this community here need more support. Let their voices inspire action. Because every girl, every woman, and every family deserves the chance to live with dignity, safety, and hope. Asterisk.